got disconnected and now we're going to be going live again. So, yeah.
I feel terrible that these lives just behave like that. Alright, so I'm going to introduce Dr. Nozer again before I ask him to join me so that there is lesser of network issues. So Dr. Nozer Sheriar is an obstetrician and gynecologist with a long-standing commitment to the advocacy and promotion of women's health, rights, access to safe abortion and reproductive health. He practices at the Breach Candy Hinduja Healthcare Surgical and Holy Family Hospitals in Mumbai. Awarded the FRCOG Honoris Causa, he served as the scientific chair of the FIGO World Congress. He serves as a member of the Technical Advisory Group on Maternal and Child Health of the Southeast Asia region of the World Health Organization. He is a member of the Governing Boards of Ipas, an international NGO working for the reproductive rights and safe abortion. The Guttmacher Institute, the leading research organization in reproductive health, the Center for Catalysing Change that works to empower women. He is the co-chair of the Medical Advisory Panel, FPA India. He has served as the Secretary General of the FOGSI and President of MOGS. His special interests are high-risk obstetrics, operative endoscopy, contraception, and safe abortion. I have introduced Dr. Nozer now, and I'm trying to connect to him. Hi, doctor. Sorry about the technical glitch. You're able to hear me now?
I can hear you, Nisha. How are you coping?
Super. I'm doing well. I hope everybody in your home is safe.
Everyone is, yes, and so are my patients.
I'm so happy to hear that. Thank you so much for joining me today, and thank you for choosing this profession because you're so kind and warm-hearted that every time I meet you, I hear your voice, I send you a message, your response lights up my heart. So thank you for being so awesome.
And thank you, Nisha. I mean, this is great work that you're doing.
Thank you, doctor. So I have already finished the introduction part before I joined you so that there is lesser of a glitch. Now, as we already know that the world is battling with this deadly coronavirus COVID-19 and there is a lot of panic and anxiety amongst people. Therefore, I started this hashtag 21-day lockdown challenge and I thought I will put my time to productive use for these 21 days. I wanted to talk to 21 people who are making a difference just like you. Yesterday, we spoke to Dr. Kirsi Chavda on mental health and today we're talking to you on pregnancy during COVID-19. Honestly, today's live is dedicated to a friend who I'm not going to name, who is pregnant today, and I thought of her, and therefore I thought pregnancy is something that we should quickly talk about without wasting a lot of time, because I'm sure the first thing that would come to a person's mind who's pregnant is there are so many questions, right? What's going to happen to my baby? Am I going to be more susceptible to this infection? Can I do a COVID-19 test? How am I going to do my scans? There is so much that we cannot even begin to imagine as people that pregnant couples might go through. So please tell us whatever it is that you want to share in this space as a doctor, and then I will ask you my questions if I feel that you've not already spoken about it. So can we just start with our pregnant women at higher risk from the infection of COVID-19?
Right. So, there's very little good news with COVID-19. But if there is a small sliver of good news, it's for me as an obstetrician. Because when we dealt with the H1N1 epidemic 10 years ago, a pregnant woman was 4 times more likely to be admitted to hospital, and 6% of the deaths happened to pregnant women.
Oh.
From everything we know about COVID-19, COVID-19 does not seem to treat pregnant women differently from what it treats the general population. So for me, I know it's a tragic time for the world. I know we've got so much loss of life, but from all the information we have today that comes from China, that comes from other parts of the world, mind you, we are early in the epidemic, there seems to be some protection for the pregnant woman in general. They've done studies and found that the ones who've delivered do not seem to have transmitted to their infant. They've done studies. Yes, they've done amniotic fluid studies. They've swabbed the cord of the baby when it's born. They swab the mouth of the baby when it's born. They checked the placenta. They looked at the vaginal secretions. And the great news is that all these were negative for the virus. In fact, they've even checked the breast milk and found that as of now, the breast milk is negative for the virus. So, I mean, if there's something that on the second day of your 21-day challenge that people can kind of heave a sigh of relief about, it's that
Absolutely.
pregnancy does not put you at a disadvantage with this particular vicious infection. It puts you in the same boat as other people. Now, obviously, there will be pregnant women in their 40s. There will be pregnant women in their 40s who are diabetic, who would be high risk for like any other person with the COVID epidemic. So this is for me the favorable part. Now, we have to understand that when we are talking about the high risk essential service population,
Doctor, I'm
obstetric.
sorry to interrupt. Is it possible for us to combine our language in Hindi as well as in
Of
English?
course, I'll do that. So मैं क्या कह रहा था कि जो हमारे पास ये बीमारी के बारे में जो इन्फॉर्मेशन है, ये हमें बताता है कि जो गर्भपात, जो प्रेग्नेंट वुमेन है, जो गर्भ वुमेन है, उनको इस बीमारी से कोई ज़्यादा रिस्क नहीं दिख रहा है. जैसे कि बहुत सारे टेस्ट, एक डॉक्टर चैन थे चाइना में, उनके सब जो रिसर्च है वो अभी पब्लिश है और डिस्ट्रीब्यूटेड है. और मैं जो कोट कर रहा हूँ वो WHO कह रहा है, रॉयल कॉलेज कह रहा है, हमारे अपने देश में हमारी ऑर्गेनाइजेशन है FOXI, वो कह रहा है कि आप डरिए मत, आपका रिस्क तो है. याद रखिए कि हमारे देश में हर साल 40 मिलियन वुमेन प्रेग्नेंट होते हैं. ओके, 40 मिलियन वुमेन इज अ बिग नंबर. उसमें से 27 मिलियन डिलीवरीज होते हैं. तो अभी इतने बड़े नंबर में तो इन्फेक्शन होना ही है. सो वी हैव टू अंडरस्टैंड कि हम इन्फेक्शन को तो देखने वाले हैं, लेकिन ये इन्फेक्शन उनके लिए कोई ज़्यादा हानिकारक नहीं है जैसे कि वो उनकी एज के किसी और के लिए हो जाता.
Right. So this is extremely important information that you have shared. You've actually shared a good news that COVID-19 doesn't spread through breast milk. And when the amniotic fluid was checked amongst pregnant women, the COVID-19 virus wasn't present. This is absolutely, I feel, a miracle news that you've shared, because I'm sure with all my friends and followers who are listening to this right now and who are pregnant or who are about to get pregnant, this is a huge sigh of relief, because considering the fact that ये वायरस इतने तेजी से स्प्रेड होता है, जहाँ पर आप कॉन्टैक्ट से हाथों में अगर आपके वो वायरस आ जाए और अब आप अपने आँख, नाक या कान, मुंह में हाथ लगाएं तो ये स्प्रेड हो सकता है. ये कंसिडर करते हुए ये बात जानना कि ये वायरस एमनियोटिक फ्लूइड से, ब्रेस्ट मिल्क से, as per the current studies, नहीं spread होता. This is a huge sigh of relief. Thank you so much. I'm sure a lot of people are listening and are already feeling relieved about this fact. Okay, another thing I wanted to know is that what care is available in the current scenario for pregnant women? Are there any laws that restrict them from traveling? Because right now there is a 21-day lockdown period. I know that my friend is in the second trimester, and in the third trimester she was about to go to her family back in Bangalore, but now she cannot really take the flight. So, I mean, how do you suggest this? How does this work?
Okay. So firstly, we have to understand that we are early in the epidemic. It's been a few months. It seems like forever, but it's been a few months since China reported it. So presently, our big concern is about women who are close to delivery. Maybe we learn a lot of things when we look at the first and the second trimesters. So अब जो भी हमारा information है वो late pregnancies के बारे में information है. So पहले तो जो हम repeat यहाँ नहीं करेंगे, because thankfully it's being put on and on and on. Do not take the general instructions lightly. They are as, if not more important for pregnancy than other things. Now I'm going to tell you something very interesting. क्योंकि अभी लोगों ने, because people have become more careful, over the last few weeks, I have seen fewer of the typical infections and viral infections that we normally see. So I wish people always did what they are doing now, became more responsible, hand washed more, sanitize themselves, work careful, because we'd be so much healthier as a race once we get through this. Now comes the problems that people face. You're absolutely right. I mean, I have a niece in the UK who's pregnant. I've got patients of mine who wanted to travel. Someone just asked me, can I go to Goa? I want to go by road because it's safer there. And I say, no, at this point in time, stay put. Your
Right.
best safety is where you are, because remember, people are most vulnerable when they travel. Even when the airlines were operating, one of my patients recently thanked me and said, because I stopped her from traveling a month ago, and I said, you
Right.
can control your home environment. You cannot
Yes.
control airports and airplanes. So forget
Correct.
it. Do not budge out from where you are. You are safe where you are.
Correct.
Secondly, you have to understand that there are certain important necessities in pregnancy, and that's going to be difficult and a burden on the system. I'll tell you what I am doing in my practice. I have to
Yes.
appreciate the work my staff is doing. Please understand,
Absolutely.
today, if anyone is going out there to care for you, please applaud them and respect them. It's not easy. Their families are uncomfortable, the
Yes.
localities where they're uncomfortable, but we need them. So we've now cut down seeing patients to twice a week. We have
Okay.
staggered a point. We only see the patients who are absolutely essential, and we are not
Right.
seeing new patients. Unless someone really has an emergency, I will call them to hospital. But I am
Sure.
seeing patients. We make sure
Sure.
nobody waits in the waiting room. Nobody has to come in contact with each other. The whole place is
Right.
wiped down regularly. So you have
Right.
to see your doctor. For example,
Right.
if you're 1 month away from delivery, you have no choice but to see your doctor. But if
Correct.
you are 24 weeks, you know what? You can wait for the next 2 or 3 weeks and just
Yes.
reach out to your doctor on phone or by email or by whatever other means your doctor is able to
Right.
accept your calls, WhatsApp. And please be considerate, because doctors are getting a lot of phone calls. I have absolutely no problem receiving them. My staff doesn't, but then sometimes we have to appreciate the fact that, send messages and wait for them to call back. Now comes
Right.
the next thing. You are homebound. Remember, you are suddenly restricted. So you have to make an effort to keep yourself healthy. What you
Correct.
eat. You can exercise in the house. You don't have to go
Yes.
out of the house to exercise, and
Right.
start preparing and planning for if your delivery is a few weeks away. And let's face it, a lot of people keep preparation to the last moment. You may feel you're not prepared. However, you can start preparing for it with whatever you have at home, with whatever your friends can share with you. So you can prepare
Correct.
it, sterilize it, sanitize it, so it's
Correct.
available for you at the time of delivery. Traveling to your doctor, I don't think, I know people will stop you, but when you're very pregnant, nobody is going to stop you, and you're
Correct.
going to be
Because
able
then
to
it's
go
visible.
to your doctor. Absolutely. As far as the
Yes.
staff is concerned, we try and give them letters, but I wish the authorities did something to give them a kind of, anyone who is
Yes.
essential should
Yes.
be given some kind of a pass to move around.
Identity card.
And I just
Correct.
hope people don't misuse it. But these people are necessary, and if they don't come, we can't function.
I absolutely want to highlight this point which you just mentioned regarding the staff that is at exposure. Therefore, I've called Karan back. He was behind just technical, sharing the technical, checking if technicals were okay. So today, Dr. Nozer, I have invited Karan on the chat because obviously a pregnancy can never happen without two people, and he's been my 50%. So I definitely want him to be a part of this conversation too. So Karan also runs a franchisee of a diagnostics center called the Suburban Diagnostics. He's got one
Yeah.
of the fofos. And this point which you just mentioned that, at the moment there is so much panic in terms of the lockdown that even the important people, as much as, people are appreciating and applauding the efforts of the frontline workers, like, everyone, whether it's waste management, doctors or firefighters or our security guards. But a lot of people are actually facing difficulties even from this side of it to travel because they don't really have that identification or a special pass by the government. So you want to say something on this regard, because even your people, unko bhi
Yeah,
kuch
yeah.
dande pade
So,
the or something like
uh,
that happened, no?
yeah, so because this is something that we are not very equipped with. This is something that's just happened. It's very new. Nobody ever had such special iCards made for them, or something specially done in such a situation, because it has not happened during our lifetime as well. So yes, a lot of people in the healthcare industry were traveling. There were people from staff from hospitals that were not allowed, because the day when I think on Monday, after the first Janta curfew, people went out. The local trains were stopped, so they didn't know what to do. And people in Bombay do travel long distance. So they were not allowed to even go ahead from the station, at the entrance of the station, that you can't go inside. A lot of people who try to, so police kind of told them, they did not listen, so thora dande bhi pade. But that's all okay. That's how it happens. Though they were already trying to reach places, also almost every staff is coming on an alternate day now. So there are measures, there are other things. How we are trying to support even the healthcare industry, like how we are also trying to give them the max that we can do from our end. But it's hats off to the effort, and we need the healthcare industry to function right now, because they are the only source who can help the people who are infected in certain way. There are tests for COVID-19 that people need to do if they test positive, or even if they want to go ahead and test. So that's what they can do.
All right, doctor. Thanks, Vipu, for sharing this.
Karan,
I
yeah.
have yes, please
Just one
continue,
second.
doctor.
So, it's not just the COVID-19 patients. You still have a population who's having heart attacks. You still have a
Yes, sir.
population who's having cancers. You still have a
Yes.
population who needs care in these difficult times. And it's not just the authorities. Sometimes it's also the people they live with. Families are afraid. They don't want their people to go out. I mean, hospitals are working in really difficult situations now. They're having so we have to understand. So I wish we also had messaging when we put all the other messaging out, when on media, social media, where you tell people that these are essential to the country now, and everyone should support what they do and not come in their way. And I wish we had a list, just as you have at the airport in security. I wish we had a list of all the possible essential services, so you could print it out and say, this is what I belong to. Mr. Narayan Murthy was saying cyber security. I mean, the country would collapse if you didn't have the cyber security experts going to work. So we now, I know the first 36 hours have passed, but it's time, and we don't have time. We need to do this tomorrow. We need to do
Yes.
this really, really quickly. And that's what I hope you can put the message out and push for.
Yes, we will
Thank you,
definitely do this, doctor. Thank you for highlighting this. We will see what we can do in this regard, and we will talk about it more often and try to create more awareness, and hopefully it will reach the authorities. Now, coming back to the pregnancy part of it, I have a couple of more questions for you. So, say for example, a woman already has contracted COVID-19. So is it okay for her to deliver vaginally, or is it scary if she can go through a C-section? Which part is more?
So this is all beautifully already put out in guidelines. So we actually have 3 different patients. One who is normal, one who has a suspected contact or suspected disease, and the third who has a diagnosed disease. As of now, it does not seem like you have to change your obstetric practices in how you deliver the patient. But the process of delivering the patient, we're always careful with delivering a patient. But obviously, if you're delivering a patient who is diagnosed COVID-19 or virus positive, the whole requirement at the institution or the hospital will have to change. Just as you've got isolation wards, your ICUs have to change. That delivery room will have to have those safe bodysuits for the doctors. We would have to be fully covered. And obviously now you have to understand, and people will have to accept. I've had 3 deliveries in the last 4 days, okay?
Wow.
Out of which 1 or 2 delivered normally, 1 C-section. Normal patients. We have stopped all visitors. I know it's a happy time in your life, but this is one time you don't want anyone visiting you. We allow only 1 attendant per person, and you should be the people asking for it if you're close to term and delivery. Now, the delivery does not have to be a C-section if she's COVID-19 positive for the medical reasons, but if it is for the surgical, for an obstetric reason, then तो ठीक है, तो cesarean हो सकता है, and cesarean में भी दोनों anesthesia हो सकते हैं, but we would prefer a spinal or a regional anesthesia. By the way, epidural spinal can be given. I would give a patient an epidural while she is in labor. But obviously, if she is going into respiratory compromise, then it would have to be a general anesthesia. And I suppose as soon as she delivers, she would have to go back to the ICU to be nursed back to health. Feeding at this point in time, there is a few instances where infants have been infected. We believe that they might have been infected by contact after. Here we would have to be a little measured. This is one of the few times when, after sanitizing pumps and everything else, you may want to pump the milk and a non-infected person may feed it to the baby, and we have to keep a certain balance. I'm again going to stress, we are learning.
Yes.
January is when it started. We've not even
Right.
finished March. Next month,
Right.
the recommendation from WHO might be different. But as of
Right.
now, WHO says we can go ahead with breastfeeding in these women.
Right. So, doctor, also I wanted to know that if, say, you've already answered, the about vaginal birth and C-section for women who are probably suffering from the disease, what kind of precautionary measures can be taken? So, I wanted to know that we will sum this up now, because for people who just joined us, you said that for pregnant women, it's completely safe to breastfeed their babies, even if they
Uh,
are.
to give the baby's breast milk, maybe
Yes,
if she's infectious, and you know that this is basically a contact disease.
correct,
Okay,
correct,
this is a disease which comes from the fomites. This is the disease which comes from, and interestingly, it does not seem to be there in vaginal secretions, as I said. So
correct.
obviously, the contact of the baby might, if that is going to be high risk for the baby, then breast milk, yes, contact, no.
Yes, so you're just like blood, basically. When the blood is in your body, which I remember I learned in my biology class, it's odorless. But as soon as it's released out of your body because of the infection and the bacteria that infects it, it starts smelling. It's the similar kind of a case, correct?
Well,
Where breast milk,
breast milk is fine, but
yes,
the mother might
the
be secreting bacteria not through the milk but
yeah.
other
For
ways. So
example,
that's where
if the
you
areola has the
get.
COVID-19 virus, or the skin has it, then it might go into the baby's mouth. But
Yeah,
per se, the breast milk in a concentrated direct way does not
is
have
sterile.
that.
Is
Is
sterile.
sterile. The amniotic sac is completely sterile. It's not passed from the mother to the unborn baby. This is what you want to
Unlike
say.
HIV, hepatitis B, and other illnesses. Yes.
Correct. So that is basically, really positive ray of light for women who are pregnant. Also, you said regarding C-section and vaginal birth already that it's best that none of the visitors come and visit even normal women who are not suffering from COVID-19, just for prevention. And the baby is kept separately, and the breast milk can be given, and some other person who is not infected with the disease can be feeding the baby.
Yeah.
Correct?
That's right.
Please correct me
That's
if I'm
right.
wrong. And you also mentioned that if you are late in your pregnancy, then obviously it's very, very evident that you are very pregnant and the authorities are not going to stop you. You also mentioned that we, in this moment, need to respect the fact, just coming to the windows and applauding for the spirit, and not really feeling the everyday pressures of the health workers also is a very, very sensitive topic. We must understand their constraints as well, because they are all human beings just like us. They travel in trains, through buses, and they're going through the same kind of problems. Society is scared of them. Their family is not comfortable for them to go out and come back because they might carry the disease. So we need to be a little more considerate. You also mentioned that as a doctor, you're trying to be there for your patients as much as you can, even on your phone. You've cut down your visits to twice a week, but of course you're there for all your surgeries and emergency sections. And great. So I believe that we spoke about traveling during pregnancy and everything. You spoke about women eating healthy. Home quarantine is something that you stressed on. Do not step out unless it's really,
very
really
much needed
important.
right now.
So I believe we've had a good chat, doctor. Is there anything else that you would like a message to be
Yeah.
passed on?
I can see one or two of your followers have asked about the first and second trimester.
Yes,
As
Yes.
of now, treat it no differently. Yes, there are certain very important landmarks, like doing a dual
Yes.
marker test at 12 weeks or an anomaly scan at 18 weeks. Other than
Okay.
that, your routine antenatal checkups can wait. This is also a good time for you to be sitting and preparing and learning about what's happening to you. There are a
Correct.
lot of great experts who are putting information out. And finally, I just want people, I want honesty. I think we should have transparency. If you're not feeling well, I know there have been instances where people have concealed important histories. Like if they have a fever, they're afraid. If I tell them I have fever, they won't see me or they won't let me come to the clinic. You're putting a
Yes.
lot, you will be looked after. Okay?
Right.
Even if you're
Right.
COVID-19, you will be looked after. Don't be afraid. We are getting our
Yes.
act together. And now, fortunately for us, private hospitals, many of your followers may need the private hospitals, are going to be involved with the care of these patients. Be honest, be truthful, you will get cared much, much better. And you said that very nice thing about applauding the caregivers, all kinds of caregivers. I just want to say this to India. It's really nice, it feels good, but please remember this: when there are no crisis situations, it breaks my heart when I hear about young doctors in government hospitals being assaulted and beaten up. It breaks my heart when people do those things. And today I think India must stand up and stand against those people and tell them, these are the guys who are going to stand up for you in a crisis, and we need to stand by them when those things actually could be a tragic wrong, but that's how you need to deal with it more sensibly, more sensitively and widely. So let's look at other things also. We really appreciate what's happening.
Yes.
You can help the medical profession by looking after yourself. I mean, look what
Yes.
happened in Italy. You didn't look after yourself, it was a
Right.
disaster. We cannot
Yes.
handle more than a certain number of patients. So be
Correct.
healthy, be safe, look after yourself. You'll have done a service to your family, to your community, to your country. And the
Correct.
other thing I've learned is, you know what? One last thing I've learned: the world is a very, very small planet in space.
Absolutely.
We are all in it together. And every time we find differences between ourselves, remember those differences do not matter. This is
Not
what
matter.
matters. And let's stick together for everything and not just for this.
Absolutely. So
Thank you so much,
so
doctor.
beautifully put. Basically, you're saying that a microorganism does not really see whether you're a Hindu or a Muslim, or whether you're rich or you're poor, or you belong to which country and which class. It just attacks you if you don't take care. So everybody, please stay under home quarantine. Doctors are available for you. Nobody's shying away or hiding away. And please come ahead if you have symptoms. Reach out to your doctor. Share. Do not be scared. That is the only way you can actually be helpful to your own self, your family, and to the entire human race at last. So, at large. So, all the pregnant women and the couples out there, this is good news for you guys. Please stay safe, stay under home quarantine, step out only if you have to. Your doctor will tell you when your important scans are necessary, and that's when you should step out. Thank you
So,
so much, doctor, for
thank you,
joining us
doctor.
today and
Thank
being
you.
so
Thank
lovely
you,
as always.
Thank you.
both of
Thank
you.
you.
It's always lovely to see you, if it's not, even if it's not in person. And Karan, thank you for being such a great example to the men. Men have really become much better. I love it when they are with the
Thank you, doctor.
partner, and it's been like this for the last few years. But we need a lot more people like that out there, and that unconditional 100% support. Someone once asked me, "What's the role of the husband in pregnancy?" I said, "Punching bag." She's going through it, all right? She's going
Yeah.
through it.
I,
Just
yes.
stand by her and support her 100%. Thank
Thank you
you.
so much, and you've been yourself an inspiration. And thank you so much for giving us your time. And thanks to the efforts that you and other doctors and everybody in the healthcare, everybody in the administration in India is putting in. So, guys, let's go ahead, respect that fact, stay home, stay safe, let them do their jobs, and don't wander around to click selfies only because the roads are empty. That's not the way we should do it. So, take care, doctor. We'll see you.
Thank you, doctor. I can't wait to give you a big hug as soon as this whole thing is over. Love to your
Thank
wife
you.
and your family as well. Thank you.
Take
I
care.
will
Doctor,
convey it. And love to all your followers. Bye bye.
thank,
Thank you.
thank you,
Thank you so
doctor.
Bye.
much.
No,
Okay.
All right, everybody. So here I am with my punching bag, as Dr. Nozer Sheriar just
Yeah,
said.
he knows a small person, so he knows who was the punching bag always.
So he's been an amazing person, and it's really important for you to have a good doctor who's not just a good doctor at what he does technically, but also a good human being, because a good human being will take good calls as a citizen, as a human being, and he's there for you morally. I feel Dr. Nozer has been that one person I've known for years, and every time. Even the first time I gave him a call, I remember it was an emergency, and he received the call with so much love and affection that, you know, it's left a huge imprint on my heart, and I will remember. So this is one person that is making a difference, not just in our lives, but also in all the lives that he touches, directly or indirectly. So that was day 2 of the hashtag 21 day lockdown challenge, and I hope you pregnant couples have had the information that you were looking out for. You're safe as far as you don't step out of the house.
Yes, so stay safe, guys, and I hope this was quite informative for you all. And don't listen to everything that's going around. Please use your own intelligence as well. Stay home, stay safe. Let's not get out in public too much. Only if it's necessary, step out. Um, let's not have large crowds. What we are seeing on the news, it's going to be a very irresponsible act on our part, because this will keep continuing. We need to break the chain. Stay
Yes.
home. कोई बात नहीं, थोड़े दिन सब्जी नहीं मिलेगी तो दाल चावल खा लीजिए. एक हफ्ते 2 हफ्ते में पता चल जाएगा कि किस किस को है. So let that come out. That's why it's a 21-day lockdown that's happened, so that in these 3 weeks, whoever is infected, we can know about that. People who get affected also, please go to hospitals, tell them, test yourselves. This is the only way you can save yourself, your families, because whoever steps out will have the responsibility of coming back home and infecting other people or the family. So
Yes.
I don't think you want to take that risk and then come back home.
And the worst is you will
So-
not even know it has happened,
Yes.
because the virus is under such a long incubation period. It won't show symptoms until the damage is
Please
done.
sanitize. Please, look out for everything. Even if you go out, come back home,
And have a shower.
have a shower, take everything,
Wash your clothes in
it,
hot
your
water.
clothes, your shoes, anything you touched, any currency you touched also. Just
Correct.
be careful, because हम लोग ये सोचते नहीं है, कुछ चीज़ लेकर आते हैं, so हम लोग सोचते हैं कि चलो ये चीज़ को ऐसे ही घर में पकड़ा दिया. Even that is being passed on. So all these things need to be very practically done, carefully done, because anything could pass on.
So Karan is the only one who stepped out for all the
Yeah.
grocery shopping and all of that.
Twice I did. but-
Twice, and I remember that when he came in, it was literally a 1 hour process, because we would talk on the phone. We would say,
Yeah.
don't even touch the doorbell, don't hold the handle. He would wear gloves and a mask and go,
Yeah.
and obviously carry a sanitizer. He was really, really extra careful even in public. And I would open the door before he came with my gloves on and different types of sanitizers, and I would have a huge basket. So this is a tip that you can take away, all the pregnant couples as well, because one
Otherwise
of y'all
also-
has to stay home and the other one will step out to buy something at some point, some medicine or something, so if you have to go out there,
Yeah.
then these are the precautions you need to take. So I used to take a basket, wear the gloves, sanitize every
Everything
single
that I was passing on. So
packet
basically,
that came.
I just spoke to somebody yesterday also. So
Yeah.
they were saying that I was just explaining the same things that we're talking about. So they went out. They said, "नहीं हमें कुछ medicine चाहिए था." So we went out
Right.
to the chemist and came back. I said, "Did you wear a mask?" No, I did not. I said, "Why didn't you wear a mask and go?" Maybe because somebody else could infect you also.
Mhm.
कहते हमने तो सोचा ही नहीं. मैं कहा लेकिन अगर आप ऐसा नहीं करोगे तो, और आप कैसे गए हो? अच्छा गाड़ी में गए. अच्छा और बाइक पे भी जाते हैं. तो अगर आप हैंडल टच कर रहे हो, गाड़ी पार्क कर रहे हो, 10 लोगों से ब्रश कर गए, आप
का बटन
एक
दबाओगे,
करेंसी दोगे किसी को, किसी से चेंज लोगे,
राइट,
उसके बाद बटन दबाओगे, लिफ्ट का है, कुछ और है, अपने हाथ कहीं लगा लिया, मुंह पे कुछ बांधा नहीं है, घर आए, घर आके नहाए नहीं है, घर आए और सीधा जो चीज ली थी वो किसी और को पकड़ा दी.
करेक्ट.
So see, everything is transmitting. We are not understanding the small points. It is very important to know the every point. You'll have to break it. So
Correct.
even if I came home, first there were some थैलाs that was placed outside the house. She was standing
Correct.
out with the gloves. फिर उसके बाद मैंने एक एक चीज फाड़ के, और मेरे तो ग्लव्स को भी मैं सैनिटाइज कर रहा था बार बार. सो वहाँ से मैंने एक एक चीज, अगर कोई सब्जी भी है तो थैले में से सब्जी निकाली, उनको दी, उन्होंने एक
So
चीज में
आलू एंड
रखी.
प्याज हम सीधा एक
धूप में
बास्केट
रख
में डाल
देते
के
हैं.
करण ने उल्टा कर दिया और हमने सीधा धूप में रख दिया
Then
for 2 days, because
everything
the
was
virus
washed.
doesn't survive above
Yeah.
30 degrees apparently. And even Karan's clothes, he directly, like, obviously he didn't strip out of the house, but
Yeah,
he came,
but I
had a
removed my
shower.
gloves. I
Yes.
removed my gloves first,
Correct.
picked up my shoes,
Yes.
and then I went
Ran
to the
straight to the
bathroom.
bathroom.
So I washed my cap, my shades, my mask, my clothes were put in a washing
Phone was
machine with
sanitized.
40 degrees. My phone was sanitized. My purse was sanitized.
Correct.
The card that I used was sanitized. So everything will have to be done in that way. I know it might
Yeah.
sound like an OCD, but
Yeah. No,
Do you
it's
want to
not.
take the chance?
You better be called
of-
whatever they call you.
Yeah, but do you want to be? You want to take the chance of infecting anybody at home?
Correct. It's your
So that is the
responsibility.
important.
Don't say that यार हमको तो कुछ नहीं होता होगा देखा जाएगा हम तो मर जाएंगे blah blah blah. Please don't be so
This
responsible.
is not a
because
World Cup that people are celebrating out in the
yes, guys,
public.
guys,
It's
please
really bad.
celebrate within the confines of your home. You have other people. Today we have social media. Come online, talk to people. You know, pick up your phone, give a call to your friend, your family.
Yes.
Or there's enough motivation available online. And the source of your information, the World Health Organization, I always emphasize on that. The Prime Minister, Honourable Prime Minister, Mr. Narendra Modi ji keeps coming on television, and that information is the correct information. Do not forward WhatsApp messages without authenticity, unless the source is authentic. Okay, everybody is available for you. Your medical relief in the country is available, so let's not panic and let's be considerate toward all these people and all the pregnant people out there. Have fun, celebrate this phase. It's one of the most beautiful phases that you will go through. Apparently the first, second and the third trimester. The second trimester is known as the honeymoon period, because I know a lot of you are in this phase right now and the morning sickness is gone and you're not so big, so you can move around, you know, have some we time, us time with your partner. And
be the
that's
punching
it.
bag, guys,
Yes.
because that's the only thing. And if you're
be a good
pregnant,
punching bag.
the men have had it, so.
And remember, Dr. Nozer said the 12-week scan and the 18 to 20-week scan, anomaly scan, those scans are really important. I am not a doctor, therefore we had Dr. Nozer Sheriar who came live today and spoke about
Speak
what
to your doctor
and not what not to worry about. Yes, speak with your doctor if you have any concerns, and come out in the open if you have any symptoms. Do not hide.
Yes.
All right. So
All
have
right.
a happy pregnancy and follow the hashtag 21-day lockdown challenge. With me, I will be live tomorrow at 5 p.m. with another guest who is making a difference. I like hosting this with you. You should come more often.
No,
write to me or write to him for people who want him to
It's
come
good that
with
you're
me.
doing this. No. So I'll do something else. No?
My host and my toast,
Oh my God.
my pregnancy partner. Thanks for getting me pregnant and giving me this
Was this
beautiful
about
child.
us? Okay.
No, but
It's
it's a
not-
pregnancy life, so we can feel free to show a little bit of love. The world needs love right now. Give me love. I need love.
I will give you love. Don't worry about it.
Okay,
Okay.
guys, bye. Lots of love. Stay tuned. I shall
Bye.
see you tomorrow at 5 p.m. Goodbye.